Good afternoon, veterans, families, caregivers, service members, and veteran stakeholders. Thank you for joining this Michigan Veterans Affairs Agency virtual coffee hour Teams presentation with questions and answers. It's our hope that at the end of this hour, you're better informed about resources for older veterans. This presentation will be recorded for future use, including use on MVAA's social media pages. Please submit any questions for our presenters by using the Q&A icon on the control bar that appears as you hover your cursor over the screen. Our moderator will select questions that will be presented to each of our guests. If you see a question pop up in the Q&A box that you think is important, please like that question so we can gauge how many of our listeners would like to hear it answered. If we're unable to get to your question or you have follow-on questions, they can be directed to our Michigan Veteran Resource Service Center at 1-800-MICH-VET. That's 1-800-MICHVET. Today's panelists include Melissa Seifert, Government Affairs with the AARP, Dr. Marcos Montanini, Service Line Director for Rehabilitation and Extended Care in VISN 10 for the U.S. Department of Veterans Affairs, and Kim Stalegrave, a Veteran Service Officer with the Michigan Veterans Affairs Agency. I'm Ryan Engel, a Marine Corps veteran and partnership coordinator here with the Michigan Veterans Affairs Agency. I will be your host today. As I mentioned, today's coffee hour will focus on resources and information for older veterans. The term older is, of course, very subjective and relative term and can mean many different things to many different people. Nonetheless, the aging process occurs in all of us, and the information shared today may not all be immediately relevant to you, but it's information worth knowing, whether you need it now or perhaps to assist you down the road. So without further ado, I'd like to get into it and introduce our first speaker, Melissa Seifert with the American Association of Retired Persons, or more commonly, AARP. Melissa works in Lansing Government Affairs for AARP Michigan. In this role, she executes AARP Michigan's legislative priorities to both state and federal elected officials. She serves on the core team at AARP for veterans, military, and their families, and is the lead veteran outreach in Michigan. AARP is a nonpartisan 501c4 organization with approximately 1.4 million members in Michigan. She's worked around the Capitol for 16 years as a legislative staffer and a multi-client lobbyist. She's worked for AARP for 10 years, first as the Associate State Director for Economic Security and work focusing her attention on financial security, workforce development, and social security. She holds a master's degree in administration science from CMU. Melissa, thank you for joining us today. And please take a bit, talk about resources for older veterans.
Awesome. Thank you so much, Ryan, for having us here today. I really appreciate the opportunity to talk to all of you about AARP and our work with veterans, military, and families. This has been a labor of love for me, being appointed to the AARP National Core Team to really figure out resources that can benefit our veterans. We do a whole lot, but today we're going to focus on family caregivers and the different challenges that you may be facing during this crazy time and this pandemic. So next slide. So this is just an overview of what we see at a national lens for AARP and the work that we're doing. So AARP has about a little bit over 4 million members are veterans. And so we knew this was a very important subject to target within our demographic and within our population because we have so many individuals that are going through the woes of being a veteran and through family caregivers and those types of things. So AARP is connections. That's what we really work on. Our expertise is combining all of these different caregiving resources and providing them in one place, succinct place that you can find them. So we offer free programs and online tools to anybody if you're a member or not a member, and we connect you to earn benefits, deals, and discounts. One of the great things that we were able to do early on is create this amazing partnership with the Michigan Veterans Affairs Agency to do these free courses when we could meet in person and talk in person, but now we're taking those virtually. And so again, I want to thank this for the opportunity to do this today. We are a trusted resource on several key topics. The first and foremost is family caregiving, and we'll go into that with greater detail here in a moment. But the other thing that we do that's very important to us is fighting fraud through our Operations Protect Veterans and Fraud Watch Network. This is an amazing program that we have partnered with our Attorney General for about 5 years now. We've been doing this, and they will alert you on different scams that are taking place. We do know that a targeted audience for scams happens to be our veteran population. And we want to make sure that you're keeping up to date with those frauds and protecting that nest egg that you have worked so hard for. Another issue that we focus on is recareering work and jobs. We know that when you get out of the military, sometimes it's hard to take all those skill sets that you learned and incorporate them into kind of civilian life, and get a job and recareer and all those really important things. And then finally, our work with financial security and retirement savings. I always say, and as you heard from my bio, this was my first job at AARP, was educating on Social Security and retirement savings. It's never too late to start saving for your retirement. Typically, the last 3 years of your life happen to be the most expensive. So to start saving as much as you can early on, but even now, I highly encourage that. So I'm going to get off my soapbox on that one. Next slide, please. So the military and veterans caregivers, there's about 5.5 million veteran and military caregivers in the United States. And that's a really hard number to look at because sometimes people don't designate themselves or claim themselves as a family caregiver. If you're providing any type of assistance to a loved one, whether that be sorting out prescription drugs, making food, helping with bathing, getting to doctor's appointments, you are a family caregiver, and we appreciate all the work that you do. When we're looking at all of these things, whether it's triaging care at home for wounded warriors, as well as any type of assistance that you're giving at home, like I just said before, to help your loved one make meals, bathe, we're looking at a $14 billion in voluntary uncompensated care that is not being put back into our healthcare system. So that is an extremely large amount of money that you on the front lines are doing. Veteran military caregivers face worse health outcomes, strains in family relationships, more workplace challenges. A typical family caregiver is somebody who's 40 years old and still works a full-time job. And so to incorporate all that you're doing for caregiving, which also accumulates to about 40 hours a week after your full-time job, is a lot. And then we also know that many family caregivers for veterans are in it earlier due to wounds that have sustained from your time in the military, and you're doing it longer. So that puts an even a greater strain on the individual. Next slide, please. So AARP is so honored, as I said before. One of our great things is working with community partners and have partnerships at a national level. We were so honored to have the Elizabeth Dole Foundation work with us on creating this military caregiving guide. And I'm just going to go through exactly what this guide is and how it can benefit you, and how I can't encourage you enough to go on our website, look up this document, print it off if you're able to do so. But we went through 5 key issues that were really pertinent and specific to veteran family caregivers. The first one is to talk it out. It's so important to start these conversations early about what your caregiving needs may be in the future and how you want to address those needs. Such examples could be, do you want to go into an assisted care facility? Are you looking to go into a VA system? Do you want to stay at home and age in place as much as you can? And if that happens, what steps do you need to take in order to make those happen? Each of the things that I just talked about come with a different dollar amount, a different plan. And so it's so important to have this information right in front of you and have these conversations early, as difficult as they may be. So a lot of the times I'm giving these presentations to civilians and not veterans. And when we talk about this, one of the big things we talk about is team up. And I think one of the great benefits of being in the military is that you already have a team around you. You already have camaraderie and a family within the veteran community. And so this will not be as difficult for you as it may be for the non-military individuals that I speak with. But it's important to have people around you, a support system, family, friends, neighbors, and fellow caregivers to talk to vent to help you out in case you need a backup plan. So make sure you have that system around you as well. And like I said before, make that plan. Once you have that conversation, put pen to paper, start making a financial plan. Make sure that you have all of the things that you want and that you see for your future as an individual who's going to be needing that care, and make sure that your wants and needs are addressed in that plan. Seek professional support. You need physicians. You might need somebody to help you out in finding the perfect retirement community for you or long-term care facility, and a bunch of other resources around you, like the area agencies on aging are a great resource for many individuals, and they offer a ton of free programs to help you out. And then finally, I know this was a challenging one for me. I cared for my mother as she had cancer and passed away, but it's so important to care for yourself. These people that you're caring for rely on you, and if you get sick or if you get run down, you can't provide that quality of care that they need. So make sure you're taking time for yourself, whether that's yoga, whether that's reading a book, or just having a glass of wine, whatever it may be, but make sure you're caring for yourself. Next slide, please. So when you go on our website, which is www.aarp.org/veterans, and you go and look for this military caregiving guide, this is what you will see when you open up that book. And it really goes through exactly what you need. And I always recommend when I'm presenting this to have you all go out and purchase a binder or buy it on Amazon if you don't feel comfortable going to the stores quite yet. But get a binder and make sure that you put this document in it, as well as all the other documents that you're going to need. And this caregiving resource guide for veterans will go through all of that for you. So expect to see a glossary of terms, additional national level resources. Along with that, I want to share that we have a sister companion document that goes over Michigan resources. So these are going to be tailored specifically for the state of Michigan. And you can find that document online as well, which is www.aarp.org/MI, and that's our Michigan ARP landing page. And you can go there, and like I said, it's going to have your local AAAs, the Area Agency on Aging. We have the Michigan Veterans Affairs Agency toll-free number in there, and a whole slew of other resources for you. So just a quick checklist. It's going to ask you for your personal information, any type of home maintenance that you need, because if you do plan to age in place and you have mobility issues or equipment, you're going to have to make some modifications to your home. There's some resources there to help you out to find different hinges, different types of toilet seat lifts and whatnot. Healthcare contacts, your physicians, all of your healthcare needs. Your medication list should be in there. If you have transportation issues, or if you want to put down numbers for transportation, your financial status right now, and then of course, any of your important records like your DD-214, any VA records, or any public benefits that you currently receive. And then finally, a detailed weekly caregiving plan, because sometimes what happens is as you age, your caregiving needs are going to be changing. So I don't know if a weekly caregiving plan is up your alley, but just make sure that you're constantly reassessing that to make sure you're getting what you need from your family caregiver. Next slide, please. So now we're looking at COVID-19 and how everything has drastically changed. And we just talked about having a team, and that could be challenging now when you are in isolation or are fearful of getting COVID-19, because as we know, individuals who are 65 and older are more susceptible to getting this disease or this virus, forgive me. And so it's very important to keep yourself safe. So we want to make sure that your team, we're looking at people who are going to help you run errands. There's a lot of opportunities now to have people do this for you through, I think it's Shift and other programs like that. And Meyer has delivery systems and those kind of things. So do what you can with that. And make sure that you have a backup care plan. Somebody's there that can help you out in case your individual is exposed to COVID or something else happens. Running basic errands can be a challenge. You want to make sure that you're not being exposed to this infection. So just make sure you're being safe as you can and have that backup plan. Inventory, make sure you have essential food and household personal supplies. We don't necessarily condone hoarding by any means, but the things that you desperately need to keep yourself safe is very important. The governor did do an executive order where you can get 90-day supplies of medication, so make sure that you're using those type of resources. Medical visits are so challenging during these times, so make sure that you're utilizing telehealth when you can. AARP has a COVID-19 resource page on that aarp.org/MI page where you can really go through and find out how to utilize telehealth. You can also call your physician's office to do that. And just make sure that you're being personally safe and with your self-care. Limit visitors, make sure you're resting, any type of stress relief that you can do. We highly encourage that as well. And again, we have great resources at aarp.org, community connections, and aarp.org/veterans. Next slide is just a whole slew of different resources for you. So I am just going to have you review all of those. We went through many of those recently throughout this presentation. So next slide. And I just want to go over one more time that, you know, we honor you, we thank you for doing this labor of love, which is caregiving. It is difficult, it is challenging. You don't have to go it alone. AARP is here to help you with our plethora of resources and information. And we just want to make sure that you have all of the tools in your toolkit to do this so that you are safe, you are being taken care of, but you're also caring for your loved one. Next slide. And again, thank you. AARP salutes your care, service, and sacrifice. This is my personal contact information. Please, 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 if you have questions or concerns or anything, reach out to me. This is my personal cell phone, and so use it at your leisure. And again, thank you so much for the opportunity. And I think we're going to be taking questions after the rest of the presenters. So thank you.
Thank you so much, Melissa. A wealth of information and resources, and as veterans age, whether it be in place, an institutional setting, or otherwise, I mean, it's so important to know those those caregiving opportunities and what to plan for. So, and grateful you're on here with us today, and grateful for the many other shared outreach opportunities we've had, and we'll surely continue to have with AARP as a partner. It certainly helps Michigan veterans. Next up, I'd like to introduce our next panelist, Dr. Marcus Montanini. Dr. Montanini is the Service Line Director for Rehabilitation and Extended Care in VISN 10, serving Ohio, Michigan, and Indiana. He promotes program development and oversees the quality and delivery of geriatrics and rehabilitation and extended care services for veterans within VISN 10. He's a board certified, he's a geriatrician and a palliative medicine physician at VA Ann Arbor Healthcare System, and he's board certified in internal medicine, geriatric medicine, and hospice and palliative medicine. He's a professor of medicine in the Division of Geriatrics and Palliative Medicine at the University of Michigan. And if you're not familiar, the federal VA breaks up the country into different Veteran Integrated Service Networks, or VISNs. As I mentioned just now there, Michigan's Lower Peninsula, along with most of Indiana and Ohio, are in VISN 10, and the Upper Peninsula, along with most of Wisconsin and a good chunk of Illinois, are in VISN 12. So there are 21, I believe, different VISNs throughout the country. Dr. Montanini, grateful for you joining us today and sharing information about the U.S. Department of Veterans Affairs, geriatrics, and extended care resources.
Good afternoon, everyone, and thank you for having me this afternoon. It's a pleasure to be here, and good afternoon, veterans, and thank you so much for your service. I hope you are staying healthy and safe. But my goal today, I would like to give a brief overview of the geriatrics and extended care service that we offer to older veterans in VISN 10. Next slide. As Ryan said, again, the VA geographically is divided in VISNs. VISNs are geographic areas that include 2 or 3 states, and that's sort of an administrative distribution of the VA facilities throughout the country. So here is our VISN. We are VISN 10, which includes the Lower Peninsula of Michigan and the states of Ohio and Indiana. As you can see, in VISN 10, we provide services to almost 700,000 veterans who live in these areas. And we have 11 VA facilities, which are the red stars here. So we have in Michigan, we have the VA facilities in Saginaw, Detroit, Ann Arbor, and Battle Creek. In Indiana, we have Fort Wayne, Marion, and Indianapolis. And in Ohio, we have large VA facilities in Cleveland, in Dayton, in Cincinnati, and Chillicothe. So we provide service to veterans in all these areas. In addition to these 11 VA sites, we have 63 clinics, outpatient clinics, And if you are in Michigan, there is a clinic in Alpena, one in Traverse City, one on the west side of the state, Muskegon. So there's one in Grand Rapids. There are several outpatient VA clinics providing primary care and subspecialty care to veterans who live in those areas. In addition to that, we have 9 community living centers. Community living centers are extended stay units that VA provides. And they here in Michigan, we have a community living center at Detroit VA, Ann Arbor VA, one in Saginaw and Battle Creek. So that's again a brief overview of where we are in Vision 10. Next slide. Our main mission is to honor the veterans' preferences for care and to help the older veterans to remain independent in the face of aging, disability, and illness. So we want the veterans to take advantage of all the service the VA provides. And we build partnerships with the state and the community as well. We offer a wide range of programs for older veterans. Again, our main goal is to really support the veterans' health and keep them independent and help them to live as long as possible. Next slide. We offer institutional care. We have non-institutional care and extended care to veterans, and those programs are delivering the veterans home, and I will talk about those shortly. We also provide end-of-life care to veterans. Next slide. So institutional care service is basically a care that's provided in a facility, either a VA facility through our community living centers, as I said, or could be care purchased in the community, in community nursing homes. So the VA is mandated to provide nursing home care to veterans who need such care and who have a service connection disability above 70%. So that's here again, that's the VA will pay for nursing home care in the community if you have a service connection disability above 70%, or you can receive this VA care in a VA facility in one of our community living centers, which we call CLCs. The CLCs offer a wide range of services from long stay, so veterans could then go to a community living center to stay there to receive long-term care, but also veterans can go to our community living centers to receive short stay care, which is, for instance, rehabilitation following hospitalization, or if the veteran had a hip or knee surgery, could go to one of our community living centers to receive rehabilitation in a VA facility. We also offer skilled nursing care in a VA community living center. For instance, veterans who need prolonged antibiotic therapy for 6 or 7 weeks, they can stay with us in a community living center. And if a veteran needs wound care, can stay with us for several weeks in a community living center and then go back to their homes. The community living centers really provide a comprehensive and interdisciplinary care that's centered on the veteran. So the veteran really receives care from physicians, from nurses, social worker, physical therapy, occupational therapy, psychology, speech therapy. So again, our main goal is to keep that veteran independent, to improve their functional status so they will be able to go back to their home after hospitalization. As I said, we have 4 community living centers in Michigan, in Detroit, Ann Arbor, Battle Creek, and Saginaw. They offer different services. Ann Arbor, for instance, more subacute care. Battle Creek provides more long stay care and care for patients with chronic psychiatric illnesses. Saginaw provide also skilled nursing care and rehabilitative care, and Detroit offers again a wide range of programs in their community living center. All the sites here offer also end-of-life care, veterans who can no longer stay at home who have a short lifespan, they can stay in our CLCs for hospice care. VA also purchased care in the community by establishing contracts with our community nursing homes. So the veteran, again, if has a service connection above 70%, is entitled to receive care in the community through VA purchased community nursing home care. And there are multiple nursing homes in Michigan that the VA has contract with. The VA really monitors the quality of the care that the veterans provide in community nursing homes. We have a community nursing home care coordinator at every site in the VA facility that goes to those nursing homes that we have contract with. They go there every month to interview the veteran and to assess the quality of care that the veteran is receiving in that community nursing home. We provide oversight of the clinical care that the veteran receives in that community nursing home. But even if the veteran is a VA community nursing home, the veteran can come to our facility to receive hospitalization or receive subspecialty care. And we also provide care to veterans in our state veterans homes that we'll be talking about later. I know there is one in Grand Rapids, and I know there is another one that is going to be built close to Detroit. So basically, in a nutshell, that's again institutional care provided in an institutional setting. For again, we cover several services there. Next slide. Then we provide non-institutional care, basically care that the veteran can receive in their home to maintain their independence as much as possible. And that veteran, the main goal of these services is to keep the veterans receiving care at their homes. And by doing that, we can delay transition to nursing home care, either in the VA or in the community. So we have several non-institutional care programs that we offer to veterans. For instance, home-based primary care is home care that the veterans receive in their homes. And we establish this home-based primary care teams at every site. And the team includes a physician, a nurse, a social worker, a psychologist, a pharmacist, a physical therapist, and they go to the veterans' homes to deliver care in their homes. But again, regardless of where the veteran lives, the veteran can still come back to a VA facility if they need hospitalization. But that's a great service because the veteran doesn't need to go to the hospital for outpatient care. The veteran can stay home and the care is delivered to the veteran in their homes. We also offer skilled home care. For instance, nursing service. A veteran, for instance, needs wound care at home or needs antibiotic infusions at home or needs assistance with a feeding tube. We are going to pay for skilled nursing home care. Any veteran, regardless of their service connection disability, is entitled to receive this care. We offer homemaker and home health aid services, which is basically an aid that goes to the veteran's home to assist the person with personal care services. We also offer community residential care, caring for instance, in group homes. A veteran, again, who no longer can live independently, the VA will assist with provision of community residential care. And the unique feature that we offer is a medical foster home. Basically, the veteran goes to the home of a family, and it's a private home. And the caregiver, that's again one of the medical foster home caregiver, will be basically providing not only care to the veteran, but also room and board, meals, and supervision, as well as personal assistance. So that's a great benefit for the veteran who's becoming more dependent on others, but a veteran who does not need necessarily, or who does not want to go to a nursing home. And the home-based primary care program, the team also goes to the veteran who's in a medical foster home. So that's a really great benefit. The only thing about the medical foster home is the veteran will need to pay for the room and board. And respite care is a program that we offer to the family member or a caregiver of a veteran. If a veteran is homebound, has a caregiver, if the caregiver needs a break, the VA will pay for respite care in the home. Next, we have several other services for veterans who are nearing end-of-life care. So the VA offers hospice care in a community living center and also hospice care in a community nursing homes and hospice care at home, depending again on where the veteran wants to stay. The advantage of the hospice and palliative care benefit, that's the VA covers this care 100%, regardless of your insurance status, regardless of your service connection. That again, any veteran who's diagnosed with a terminal condition has a short lifespan, the veteran then is entitled to receive hospice care paid by the VA 100%, either in their home, in a community living center, is in a VA facility, or in a community nursing home. No, also the state veterans homes also offer hospice care. Next. And the older veteran can come to a VA facility to receive geriatrics primary care. We have, again, specialists in geriatrics at every VA facility. And we also have several geriatrics clinics that, again, we provide care to those veterans. For instance, veterans developing dementia, memory loss. We have memory loss clinics of veterans having problems with falls. We can do a falls assessment and so on. So basically, our main goal is really to support the older veteran, wherever the veteran is at, to always honor the veteran's wishes for care, and to begin provide the best possible care to veterans and their families. We have resources for caregivers. We have a caregiver support program, but again, we have so many other programs that, again, that the veteran should be taking advantage of. The VA is really in the forefront nationwide in terms of providing geriatrics care to our veterans. Next slide. And I included here the VA website. Again, there you're going to have a much more detailed description of all the geriatric services that we offer to veterans. And again, that really we are offering a wide range of services that, again, we really wanted to reach out to the veterans in the community, because we really want you to take advantage of the services that the VA has to offer you. Again, we are here for you. Our mission is to continue to serve the veterans wherever they are. We are committed to provide excellent care to the veterans and their families. So, Brian, that was my message in a nutshell.
Doctor, thank you so much for being with us today. And I think, your remarks highlighted it, but I think, the adage, it takes a village, is used in many contexts and is certainly as relevant in the care and service of veterans as it is anywhere else. I mean, it takes the federal VA, it takes state government, it takes local government, it takes community partners, and it takes individuals. So we're grateful for our relationship with the Veterans Health Administration. And again, thanks for joining us and for the work you do on behalf of the veteran community. So now, last but not certainly not least, I'd like to introduce one of our own here at the Michigan Veterans Affairs Agency, Kim Stalegrave. Kim is a Veteran Service Officer with us here at the MVAA and assists veterans of all eras in connecting to resources and benefits, older veterans included. Kim previously worked for the federal VA for almost 10 years as a veteran service representative and then a rating veteran service representative. The daughter of an Army veteran who served in combat in Vietnam, Kim has been a VSO with MVAA for over 5 years and loves using her knowledge gained through experience to help veterans access the benefits they've earned. Kim, tell us about what you do and resources for older veterans.
Okay, I'm going to try to give you a Reader's Digest version of the Veterans Benefits Administration side of things and the benefits that are the monetary side of the house. The healthcare is a little different. This is the monetary checking your checking account side of the house, not the healthcare. So a lot of times that gets a little confusing for veterans. This isn't going to be all inclusive because it's a pretty complicated process, but I'm just trying to focus on some of the benefits for veterans Vietnam era and prior, because those are the seniors that we So this might be complicated, but when you need to enter the process, or if you have questions, you can always reach out to a veteran service officer through our agency or through any of the other members out there. And they can always kind of guide you through things and ask the right questions to make sure that you are getting what you're entitled to. So next slide, please. The first set of benefits are service-connected compensation benefits. So those are the benefits that are not income-based. Those are the benefits that it doesn't matter what your current income is, what your retirement funds are, it just matters that they're related to service. There's varying levels, which gets kind of complicated, but the most common are injuries or conditions incurred in service, back injury and knee injury. Injuries or conditions related to events or exposure in service. There's a huge range going from Camp Lejeune toxic water, mustard gas, radiation, asbestos. That gets a little more detailed. The most common one I see with veterans is Agent Orange exposure. You can either have been on land in Vietnam. Now they've expanded that for Navy veterans to within 12 nautical miles of Vietnam. That's a recent law change. And there's certain locations on the Korean DMZ in Eunice or Thailand during the Vietnam era that are recognized as automatic places where you were exposed. And there's a whole separate slideshow coming up about that, because that's a whole array of benefits. Another thing is post-traumatic stress disorder. So if you have mental issues, anxiety and depression and flashbacks due to your experiences, that is another benefit you can apply for compensation for. A lot of veterans tend to think it has to be completely disabling to apply. They seem to think that they were able to function and work, they were able to raise a family, that they shouldn't apply, but it's varied based on level. So even if it's just causing sleep disturbances and it still bothers you, it's something you could apply for. Hearing loss and tinnitus, ringing in the ears, those are very common things that from being around combat noises or loud engines, things like that. I know the hearing protection has improved, but a lot of veterans had less hearing protection back in the older eras. And ALS is a unique case you don't see a lot of, but if anyone had 90 days of active duty, anytime and they have ALS, they are entitled to compensation. And these non-income based benefits do pass on to the spouse. They apply in their own name. But they do pass on to the spouse if the veteran dies. The spouse becomes eligible once they apply in their own name. Next slide, please. So the Agent Orange conditions, all you have to prove is that you were there in the right spot. You don't have to prove that it was specifically caused by Agent Orange. That's the beauty of the Agent Orange conditions, because some of the other stuff gets more complicated. So if you were in the right spot, in the right location, and you have a diagnosis of any of the Agent Orange conditions, you can get compensation. And the most common are listed here. I primarily see a lot of diabetes, type 2, heart disease, various cancers and whatnot. So you would want to just review the list. Next slide. These are just additional conditions. Another common one is Parkinson's, prostate cancer, respiratory cancers. Again, it doesn't matter what your life choices were. A lot of veterans will tell me I smoked, or, you know, I did something lifestyle related. As long as you have that diagnosis in the right location, you are entitled to compensation. So next slide, please. So the next benefit I'm going to talk to you about is the income-based benefit. So that is where income comes into play. There's an income-based pension for live veterans and for widows of veterans. And this is based on your income and your medical expenses. This does not have to be caused by service-related injuries, but it does have to, cause you significant impairment, your conditions, your overall health, that you are unable to work or that you need the care of someone else. The big criteria for this, there's 3 things. There's the active duty requirement during a wartime period. So even if someone was in Germany during Vietnam or not in a war zone, if they have 90 days of active duty with at least 1 day during a wartime period, that is the first criteria they have to meet to be eligible. Then they have to have their assets and investments and net worth have to meet a certain criteria, and then their current annual income minus their expenses meets a certain criteria. So I'm trying to give you a Reader's Digest version of this, and it probably will get a little confusing. This is where you could always contact a service officer and they can go over everything with you and make sure that you do meet these requirements. Next slide, please. So these are the wartime periods, 90 days active duty with at least 1 day during these periods. So it does not mean if you lucked out and you know, you were in World War II era and you started your service December 31st of 1946 and served a year after that, and you were over 90 days, that 1 day counts. So these are the various periods of service. And for the Vietnam, it's just important to note that the veterans who served in country, their date starts a little earlier from 61, but any other veteran, it's from the 64 to 75. Next slide, please. And the net worth, this is pretty much the limit of, this is the assets. These are your investment accounts, your retirement accounts, your checking accounts, your saving accounts, all of that. You and your spouse, if you have a spouse and you're applying with a spouse, your combined investments have to fall below $129,094. It used to be $80,000, but that changed, a little more liberal, which is good. But they do look backs now. They're starting to do look backs, so you will want to make sure that you're honest about, you know, your investments and whatnot. Next slide. And to try to break down the annual income, I might confuse you a little, but I'll give you my example. It depends on how many dependents you have, and it depends on your income minus your predictable medical expenses they are already paying. So this is kind of like a reimbursement rather than money towards. We're going to look at the rate table for a veteran with no dependents. If you were a single veteran, it also varies based on your level of need for your health. Single veteran who's just unable to work due to health conditions but isn't really severely disabled, their annual income is capped at $13,752, whereas aid and attendance, where a veteran needs someone to help care for them, bathe for them, and whatnot, they're allowed to have a little more income, which is $22,939. What you do is you take your annual income for you and your spouse if you're doing a dependent rate, and you subtract your predictable medical expenses that you pay annually, and however far below that number you are is what you'd be eligible for. A lot of times it's easier to just have a VSO, a service officer, just plug this in over the phone with you and kind of figure everything out. But some of the big expenses that they take into consideration are nursing homes, assisted living facilities, caregivers, if someone pays a home caregiver to come out to the house, private health insurance premiums, things like that. So that's where a service officer can sit down and calculate with you and get everything on the right forms. So, next slide. These are just the different rates. The income changes based on, you know, if you have one dependent, if you have no dependents and whatnot. And I believe the next slide is just the same thing. Next slide. And this just goes into scenarios we don't see that much. Two veterans who are married to each other. Not very common, just based on my experience. Next slide. And there are some more rates. So this will be for your reference. You don't need to obviously look at all these, but this is just every rate for every scenario. So next slide. And here's the rate, you know, changes with one dependent and whatnot. This is the survivor pension rate. So unfortunately, the rate for the widows of wartime era veterans is extremely much lower compared to the rate for the live veterans. I don't know why, but it is. So unfortunately, it's a lot lower. They can receive a lot less their benefit amount. This has the rates for with one dependent child. Most of our older widows don't have any children anymore, so this is probably not the best one to look at. Next slide. But this is the most common rate right here. If a widow needs home care or nursing care and they have no dependents, the most common number we're looking at is that $14,742. So that's pretty much all the assistance they can get per year if their income is completely zeroed out. And again, if you want someone to kind of explain this to you step by step, because it gets kind of confusing, a service officer can help with that. Next slide. And we don't see a lot of children of veterans that qualify. They would need to be disabled themselves. There's a very low income level for the child. And next slide. That's pretty much it. So if you need assistance, you can call our 1-800 number or view our website. And there's ways to locate a service officer to kind of guide you through this, double check everything, and make sure you're getting what you deserve. And we can try to guide you through the process and do all the paperwork and dot the I's, cross the T's, and hopefully get you what you earned. And that's it. Thank you.
Thank you so much, Kim. Grateful, for this presentation and your work with veterans in general. And, you know surely better than I do, but I can't tell you how many times I run into veterans who haven't gone to see a veteran service officer, don't know what they are, what they do. And I think it's just so critical for veterans to do so because, Dr. Montanini talked about all the services provided on the healthcare side. You talked a lot on the compensation side. But I think critical for a vet, if you're a veteran listening, go talk to a veteran service officer because the benefits, not only monetarily, but in the, that can be connected to healthcare are incredible. And if you hear background noise, I'm with a 2-year-old, and I feel like if there's any fathers listening, the aging process works a little quicker on us, the father of 3 boys here. But thank you very much, Kim. And, Dr. Montanini mentioned also, the state veterans homes. He went over briefly and talked about all the different settings that the VA provides care in. And so in my experience in the past, I worked at one of our state veterans homes up in Marquette. And I can't tell you how many veterans came there needing long-term care in the same scenario I just talked about. I've never seen a veteran service officer, weren't connected to veteran care or VHA care. And, fortunately, we had a great service officer there, Jason Zadunik, who assisted, I can't even count the number of veterans and families in planning that transition to long-term care. And, for the state veterans homes in Michigan, the doctor mentioned it. We have one in Marquette, one in Grand Rapids that they're replacing that facility on site. And then they're also building a new one down in Chesterfield Township in Southeast Michigan. And those are long-term nursing care facilities for veterans and eligible spouses. And, none of us, Kim, you talked about the death pension and some of those benefits that not everybody wants to talk about, and they aren't the most comfortable subjects in all social circles, but it's important. And I think as veterans, it's important to us, legacy planning. And that doesn't just mean finances. It means kind of the impact we leave and what we leave legacy-wise, finances included, to those loved ones. So it's important to know all that stuff. Again, getting connected to your benefits, hold on, son, getting connected to your benefits and that 70 to 100% service connection, as the doctor mentioned, you're getting long-term care services for free. And paid for by the VA, not paid for out of your pocket, and you're keeping that compensation benefit. So that applies at community nursing homes as well as the state veterans homes. And there's additional resources, going to state veterans homes where the cost of care is much more affordable than you'd find in the private setting. So I'm off that soapbox, and I want to thank all our panelists for joining us today and giving us an hour of their time to share information about the plethora of resources for older veterans. Kind of at this time, I guess I'd like to go to question and answers, and I'm going to check the queue here to see what questions we have. And I guess I'd like to start with, I'm going to jump to Kim. Kim, for a family member listening, maybe an older veteran who may have no idea how to start or how to even get connected to a veteran service officer, or what questions to ask, where would you advise them to start?
I would use our 1-800-MICH-VET number, or just go to our michiganveterans.com, and there's a map on there where you can locate a service officer, and it gives you locations and numbers for various service officers in your region that are close to you. So that would probably be the best way to start. And then once you get connected with someone you're happy working with, they can go through everything and just make sure they ask the right questions and tell them everything, tell them all the conditions you have, all the issues you have, and don't hold back, and maybe they can connect you to the right benefit.
Absolutely. Great advice. And I think it's also, if you're a veteran listening or a family member, if you're paying for veteran benefits advice, I would tell you you're doing the wrong thing, because that service should be provided free of charge. And there's many, many veteran service officers, very good ones out there, that do that on your behalf. I'm going to jump to my next question here. Next question will be for Melissa. Melissa, ARP obviously does a lot of outreach related to older veterans, but also resources for the older population in general. For those listening, maybe a veteran or family member, how can they stay aware of what opportunities are out there to learn more about AARP and those resources through their outreach?
Yeah, absolutely. So, during this pandemic, we want you to have news you can use, so really important resources, but also we want you to have fun and remember that, social isolation can do a lot to really medically make you not the best. We want to make sure you're having fun and staying connected. So if you want to go to our Facebook page, AARP Michigan, we're going to have up-to-date information on there. We just did a tutorial on how to build a raised flower bed. We're doing movies for grown-ups that you can watch from the comfort of your own home. We have if you want and you're in an isolation type position, we have a toll-free number that you can use, and this is also on our Facebook page, where you can have somebody call you and just chat, and just have that opportunity. But again, our Facebook page is a great resource for you to get news you can use, but also some fun things too to keep you occupied and not isolated. And then also our website is just a great resource of not just COVID resources, not just veteran resources, but resources for everybody. And again, it's free to anyone at any age. And that's aarp.org/MI. And again, I know there's a question in there. If we can share slides, please do so for me. My personal information is on there, and I really encourage you all to give me a call if you have any questions or need more information on resources and assistance.
Thank you so much, Melissa. I'm going to go to Dr. Montanini next with a question. Doctor, obviously the impacts of the novel coronavirus are known, some of them impacts anyways, and certainly felt by all of us as it's impacted every area of society with significant impact on our older population. The VHA is the largest integrated healthcare system in the United States and probably the world. Can you talk a bit about how geriatrics and extended care, or at least geriatrics and extended care in Vision 10, is responding and assisting during the pandemic to mitigate the effects of the virus, the spread, and or otherwise?
Yes, basically we have our main goal is to make sure that the veterans are safe. So we implemented several strategies to assure that, again, that the veterans are getting the proper care that they need. Regarding institutional care in our community living centers, we follow the CDC guidelines and the Department of Veterans Affairs guidelines. Right in the beginning of the pandemic, the veterans stayed there with, unfortunately, could not allow visitors. We kept our staff in the community living center as stable as possible without changing staff frequently to avoid, again, people coming in and out of the environment. We monitor veterans 3 times a day by screening for symptoms when they are in a VA facility. We monitor our staff when they come to work. We do screening questions. And for our veterans who are staying in our community living centers, we test the veterans and the staff every other week or weekly or monthly, depends on the rate of COVID in that area, to make sure that the COVID infections are not spreading out in our community living centers. I wanted to share with you that the rate of COVID in our VA inpatient facilities, community living centers, has been much lower than the rate of COVID in community nursing homes. All the strategies that we implement in the VA healthcare system have been much more effective in protecting the veterans than the ones that we see in the community. Our rate of infections also has been lower than state veterans homes as well. So the VA facilities are doing great work in terms of assuring that the veterans are remaining safe in our facilities. Veterans, in addition to provide care in our community living centers, we are reaching out to veterans by video conferencing. For veterans who cannot come to the medical centers, we are doing phone appointments and video conferencing appointments as well. Our rate of video conferencing appointments in Vision 10 has increased almost 500%. We are really bringing the care to the veterans wherever they are by doing video, providing again remote care through video connection capabilities. There is testing available. If a veteran again feels that it has symptoms or signs of COVID, can go to again to a VA clinic or a VA hospital and can get tested right away. We provide inpatient care as well in isolated units. And the VA has been the pioneer in the country providing care to civilians during the COVID. The Detroit VA Hospital and the Ann Arbor VA Hospital opened up their doors to receive non-veterans who are very ill with COVID, and we provide care to the civilians in our VA facilities. And they rated the care that they received here as excellent care. So again, the VA has really stepped up to the plate, providing care to veterans during the COVID pandemic. Now luckily things are slowing down, but you're already, in case there is a second surge during the fall, which we hope there will not be one, hard to predict, but we're already preparing ourselves for a second surge if it comes. So again, we are really planning ahead. And we feel that again in Vision in Michigan, at least, we have been very fortunate because comparing to the other parts of the country, our rate of COVID infections and deaths has been much lower than other areas.
Thank you very much, Doctor. And you talked about the virtual appointments, which obviously have seen significant increases for obvious reasons. And just for those listening too, I mean, a number of VA medical centers have enhanced virtual outreach, not in addition to appointment specific to keep veterans informed and communicated with. I know Battle Creek, we've joined on with them on different town halls. And on the benefits side, the VBA, Dr. Paul Lawrence, the undersecretary, he's close to his 100th virtual event, going state by state, multiple in some states, taking questions. So information and resources are out there. So thank you very much, Doctor. I'm going to jump back to Kim for a moment. Kim, this is more of an opinion experience question. So in your experience as a VSO, is the greatest benefit or resource that you see older veterans not accessing or not being aware of or connected to?
I would say the Agent Orange related conditions, the service connected compensation for those, because a lot of them don't realize it's just being in the right place at the right time and having that diagnosis. A lot of them, including my own father, said, hey, some of these things are probably related to lifestyle choices or something else that happened. But all you have to have are is the right location and the diagnosis, and you're entitled to the compensation. The residuals of some of those conditions, like diabetic amputations, all that, but just a lot of people don't understand that it is actually one of the easier benefits to get through the VA because it's just that right location and diagnosis. So that would probably be the thing that gets overlooked the most.
So that's important for everyone listening. If you or a loved one may have fallen under those criteria, please, please, please reach out to a veteran service officer. And even if you know that you don't fit in that criteria and you have not seen a veteran service officer, it's critically important that you do. And if you don't know where to start, call us at 1-800-MICH-VET, M-I-C-H-V-E-T, 1-800-MICH-VET, and we'll connect you. It's 12:58, so we're reaching the end of our time frame here. I want to again thank all the panelists, Melissa, Dr. Kim, for joining us and providing a wealth of information regarding older veterans and just some of the resources and services out there. So if you're listening, thanks for participating as well in this afternoon's coffee hour. If you still have questions about the benefits and services you've earned, please call us 1-800-MICH-VET and speak with our Michigan Veteran Resource Service Center 24 hours a day, 7 days a week. Or you can find us online at michiganveterans.com. michiganveterans.com. So if you're a veteran, family member, or other veteran stakeholder, I encourage you to get connected and stay plugged in. If not for you, do it for another veteran. Have a great week.